Well, I have finally made it to Washington, D.C. here in the United States, and I am so grateful that Diane Perez has taken time to meet with me tonight, and especially because we wanted to make sure that you met Diane before the big event this coming Thursday, the World Patient Safety Day, and where we are uniting for safe care across the whole globe. And Diane has taken it as a mission to make sure that people around the world, and she is an international superstar in many regards, know about patient safety. Diane, thank you for taking the time to be interviewed tonight. And I'm really, really, really glad that we have this time together. So the
Thanks to
first thing,
you, dear Wanda. It's an honor for me.
thank you. I am really curious, what brought you to this? What is it that was that first spark for you that had you realize that globally we need to be talking about patient safety?
When I was little, my mom, who is a physician, she's an ophthalmologist surgeon, she always said that every medication, every surgery has its risks. And the most important thing is what Hippocrates said, is that non nocere, primum non nocere, first do no harm. That's the most important for a physician. And always she worked like that. Every time we had a cold, she was always very worried, because she said that you never know how this is going to end. Disease is like the war. You know when it starts, but you never know when and how it ends. So I grew up with that idea, with knowing that even a cold, if you have complications, if you do not take care, can kill you. So you have to take care of your health, and that's very important. And regarding medication, every medication has side effects. Simple aspirin can kill someone if that person has some other problems, health problems, like, for example, a problem with bleeding. But you have to be very careful with everything you take when it comes to medications. So my mother was always very careful with that. And always when she had a problem, a health problem, she went to see a doctor. And then if she was not 100% convinced as a physician, she went to look for a second opinion. And when I was little, or maybe not that little, because I remember it very well, my mom was diagnosed in Mexico with ovarian cancer. And she went to see two of the top gynecologists in that moment, telling them that she had some problems with bleeding. And I mean, she was in her menopausal age, which was very normal, having those problems. And she wasn't convinced, again, that she had ovarian cancer. Nobody in the family had cancer. So she came to the US for a third opinion. And the gynecologist here told her, you know, you don't have ovarian cancer. I don't know what you have, but definitely you do not have ovarian cancer. I check your ovaries. They are very small. Everything is normal. So go and check what you have. I have no clue what you have, but it's not ovarian cancer. Well, finally, she came back to Mexico, and what she had was amoebiasis. It's a parasite infection acquired from food that was not clean. No, basically you can acquire it with dirty lettuce or cilantro or strawberries or so. So that's what my mom had. Fortunately, she didn't have any problem with her ovaries. She took the medication for that disease and she got cured. And later on, when I studied medicine, I was in pediatrics, and the doctor was showing us about how to do a rectal, when when you put your finger into the rectum to diagnose for a little kid. He was 2 years old. He was there because of gastroenteritis. He had diarrhea, he was dehydrated, and he basically was going home that day. So this man was showing us how to do this, and the baby fell in a vasovagal reaction, and he wasn't able to take him out, and the baby died. So he said to the resident, tell the mom that the baby died. So can you imagine what a mom felt, that you are getting ready to leave the hospital with your baby healthy, and they tell you that your baby died? How can that happen? So there I realized that patient safety is the most important thing that we have to do. That as physicians, the first thing we need to do is no harm. And from there, you can start and see what you can do to help the patient. Of course, as Joe Kiani always says, nobody wants to do harm. That doesn't happen voluntarily. But unfortunately, you have to implement everything that is available in order to not do harm and help the patient get well and survive. So those two things in my life marked my passion for patient safety.
There was a train going by, so I put myself on mute. It sounds, Diane, also that it encouraged you to become a physician yourself. Is that right? That
yes, I mean, I was close to the health system all my life since I was born. Since my mom was she was a really prominent ophthalmologist in Hungary, where she's from. Then in Cuba, she was the head of ophthalmology in the military hospital of La Habana. Then in Mexico, she was also very prominent ophthalmologist. So I was close to the medical system all my life. So it was very normal for me to become a doctor. But once I became a doctor, I realized that being a doctor, I could maybe help and save lives to some hundreds of persons during my whole career. But when I got in touch with the media, I realized that I could help many, many millions of people around the world to save their lives, to give them information of what to do, and now also to empower them on patient safety. And that's the most important thing, because when you have the information, you have this power. And this is what you are doing, zigzagging, interviewing people and helping them, advocating for patient safety is the most important. When you explain to them that they need to be part of the treatment, they need to listen, they need to ask questions if they do not understand. Here in the United States, it's fortunately something that doesn't happen anymore, because when a doctor gives a prescription, he sends it directly to the pharmacy, and the pharmacy gives that prescription to you. But in Mexico, the doctor writes the prescription. And as you know, the doctors, we have the reputation that our way of writing is not the nicest. So nobody understands what we write, what we handwrite. So they give you the prescription and you have no clue of what is written there. And you have no clue, and the pharmacist has no clue either. So I personally know many, many cases of persons who got medication that is wrong, a drug that is not the drug that the doctor prescribed, and they take it for months. And then a friend of mine got started to have You know, these shakes when you have epilepsy.
Like a
Hmm?
convulsion
Convulsion.
or
Exactly. Yes, he started to have convulsions in a hospital, in an airport, and he didn't know why, and they took him to the hospital. They watched, hey, but what are you taking? He said, well, I'm taking this medication. Why are you taking this medication? Because I have a problem with a muscle, and it's an anti-inflammatory. No, this is a medication that is for the central nervous system. You should
oh my
not be
gosh.
taking. And
Oh
he
my
had
gosh.
seizures. That was the word, the convulsion. I was looking for the word seizures in
Caesars, yeah.
the airport before boarding a plane.
Oh my
So
goodness.
because he got that medication, and the doctor didn't even know that everything was going so wrong with him. So, and before the seizures, he was feeling bad and bad and bad. So these things, what you do is wonderful, because if we don't have yet the system that the doctors write the prescription and the prescription arrives with the computer to the pharmacy. But then if you don't understand what is written there, you should
Right.
ask what
Yeah.
is written here, and write it yourself on a notebook, and go to the pharmacy and just double check that what the pharmacist is giving you is exactly what you are getting, and you are going to
Right.
take exactly at the same dose that the doctor told you.
Right.
So it's very important what you do, Wanda. Could we clone you and take you to Mexico?
Well, you have tried to bring my husband's story to Mexico and even had it translated, if I remember correctly, which just always warms my heart. And I've told so many family members what you've done there. I'm so curious because you are a very unique combination. You do understand the medical system. As a physician, you know what it takes to first do no harm. And I really want to just say back to you what I think I heard, which is you knew you could also help many, many more lives as a journalist and as a person who was broadcasting. Tell me where you broadcast right now, and who is listening to the education. And on the 8th, you launched a program specific to patient safety. I'll make sure and include a link to that so that you can see what Diane produced. But tell us a little bit about what you're doing in the broadcast journalistic world right now.
Yes, I work for a company in Mexico. It's the largest network in Spanish of the world. It's Televisa. It's a sister company for Univision here in the US. And Televisa produces many different types of programs, and I work for the news. So I work with the news segments, basically, and in different news segments on different channels in the company. And I also have 2 medical programs. One is called Take Care of Your Health, Cuida tu salud, Cuide su salud. And another one is called Mi Cita Médica. That's the one where what you saw. And basically in every segment, as much as it's possible, we talk about patient safety issues. Today, I was interviewing 2 cases that, of course, broke my heart. One of them was a Barrett esophagus who had a surgery, and they perforated, they made holes, 4 holes in his esophagus, and the doctor realized just one of them and left the other 3 open. And now the patient is having food through a tube,
like a feeding tube.
Through a feeding tube, and taking his gastric acids out with another tube, and he is completely under nutrition. He's super skinny and terrible. His situation, his life changed. He lost his job. He can't work because he's so weak. I mean, he has been struggling with that. Another one is a case of a man whose little baby, 3 years old child, had leukemia, and the baby was reacting well to the chemotherapy, but unfortunately got an infection in the hospital and died because of the infection of Pseudomonas and Klebsiella. So, I mean, you need to say that. And of course, I interviewed the lawyer of these two persons, the father of the little girl and this man. And of course, the lawyer was against the doctors. And I said, hey, it's not only the doctor. I mean, it's the whole system that needs to be taken care of and needs to change and needs to implement these actionable patient safety solutions that the patient safety movement offers. And it's everything that needs to work together in society in order to give a solution to this, no? Because it's very easy that they go always against the doctor. Of course, the doctor might have is part of the problem, but it's not only the doctor; it's the whole system. Yeah. So that's very important to realize that, and the transparency is very important also. The person I interviewed, who is a friend of mine from Chile, and I met him 20 years ago in Houston when I was doing a medical program there for the Texas Medical Center that was sponsoring my program and my TV show. And he was one of the patients that I interviewed because he had a neurofibroma in his vertebra. And in Chile, they operated the wrong vertebra.
Oh, goodness.
So he kept on with the pain in his left arm. And he told the doctor, hey, I'm not feeling better. What happens? Then he said, oh, you can go to see another doctor, a friend of mine in Cleveland. Oh, because he said, I want to go to the United States to see if to hear another opinion. That's very common when people have the opportunity to come to the US for a second opinion, they try to do that. And he went to Cleveland, and then the doctor said, hey, I see a neuroblastoma here. And he never told him that the other one was not taken out, because the pathologist in Chile said that, yes, there was a neuroblastoma that was taken out. So the doctor in Cleveland said, I can't tell you if you had a neuroblastoma that was taken out or not. I just can tell you that you have a neuroblastoma in the place where it was originally diagnosed in Chile. So finally, he decided to find a third opinion in Texas, and it was a neurosurgeon from the NASA. And that neurosurgeon from the NASA told him, unfortunately, the surgery that they did to you, which was a 7-hour surgery, they didn't take out your neurofibroma. So I can take care of it if you want, but the neurofibroma, you have it exactly in the same place where it was diagnosed the first time. And he took it out in Houston, and the problem was solved, and it was a benign tumor, fortunately, so everything was fine. And the hospital finally in Chile accepted that they were hiding the information from him, and what they did is that they paid for the surgery in Texas, the hospital from Chile, which was a prominent hospital. So
isn't it just...
But those are things that, Vonda, I mean, people need to know about it. People need to know about it. But unfortunately, not everyone has the possibility to go and see the best doctors of the world here in the United States.
And
they
so
have
many...
to stay with, yes, and they have to stay. So we need to fix the system worldwide. So in every country, people can get, there are wonderful doctors everywhere, of course. We have wonderful doctors, great doctors in Mexico. There are great doctors in Chile. That's bad luck that you're not with a good one. But the whole systems need to be changed and be fixed.
It sure does. And that transparency piece is absolutely core to it, that the more we cover up, the more it perpetuates. And I'm dismayed at, and I don't know how you do it, because all of these stories that you hear and these heartbreaks of people who have suffered, people who have lost their loved ones. It really, there seems to be no end to it. And yet you and I know, because we work with people who are dedicated to making these situations, to illuminate them, so that we know what to do, we know how to prevent them, and we know how to look upstream. The missing piece, I think, are two things, and I'd like you to speak to one more thing before we conclude this interview. And it seems like we could probably do another 2 or 3 iterations of this, so I might come back and ask again. I feel as though what we really want to do is educate, not just the medical side, and increase transparency, and teach them how. I don't think you can just say all of a sudden be transparent. People need to know how. They need to practice with that. They need to be with people around them who are willing to do the same. They need to have a non-punishing environment in order to speak up and to let someone know when something's gone wrong. So we know what to do there. I want you to, especially because, Diane, you have this unique perspective of Mexico, the United States, and other countries as well. And my guess is that you see the same thing that a lot of people do when they look at this internationally. The rates of error are about the same, the harm rates about the same. And so what is it that you think is universal as we unite for safe care? What's universal, no matter what country you go to, whether you're in a United States with the premier physician on this particular disease or issue, or you are with a smaller village that is, really attentive to doing no harm, just as everyone else in the world is. What is the one thing that you would say to the general public? What would you have told me before my husband died? Before we walked into that hospital, what is it that the general public needs to know?
I think that we need to empower the general public, Fonda. What you are doing is incredible, because we need to get information, to give information to the general public about every health issue and everything that they can do to help in this treatment of their loved one or themselves. When we are with a loved one, I learned from you that you advocate with patients to tell them, if you are in a hospital with a loved one, don't be just there reading a book when the doctor is there, or go out to leave your family member with the doctor. No, stay there, listen, write, take notes, ask questions. Don't be shy, ask questions. The doctors are happy to answer them. And it's very important to do not stay with any doubt about the treatment. That's very important. When my dad had a surgery in the United States, he had an aneurysm in the aorta, and they needed to put a Dacron tube in the aorta with the renal arteries and the mesenteric arteries. So it was a huge surgery. It took, I think, 10 or 11 hours of surgery. The surgeon was great, wonderful. And I am very thankful to the surgeon in Mexico who told me, hey, I can do the surgery for your dad. But I want to be perfectly honest with you. I do that 2 or 3 times a month. My teacher does that 2 or 3 times a week. So I would suggest you to go to Houston with my teacher. And appreciated that as you can't imagine.
Yeah.
I mean, to lose a patient with such a huge problem in the private system, no, because in Mexico it was a private system. My dad has his insurance from the French government because he used to be a French diplomat. So they paid for all the healthcare, so he could have stayed with that patient and operate my dad. But he was super honest with me and told me, look, I can do it, but I'm sure that my teacher in Methodist Hospital in Houston can do it better than me. And so that's the kind of transparency that we want to hear in everyone. And when my dad, after intensive care, came out to his room, I was the first to stay with him at that night. And I was watching that his tube was not draining. And I said, hey, I waited a little bit and then I called the nurse, hey, I see that it's not draining. Said, don't worry, it will. Okay. 1 hour later, I said, it hasn't drained a drop. I mean, I'm concerned. Could you please call a doctor? So the doctor came and it was not draining. It was like, it was blocked. So they solved it and then it started to drain. But I mean, of course, I'm a physician and I know and I check, but everyone, to check if the solution is going or not, everyone can do it. You just need to ask the nurse, hey, how many drops needs to fall in how frequently, and what do I need to do, and how it, and everything. Be part of this treatment when you are a family member who is with a loved one in the hospital. And a friend of mine, a very close friend of mine, Vonda, his father had prostate cancer, and he was reacting very well to the hormonal treatment for the prostate cancer. He was very well, but he died from the same thing that Yogiraj Charles Bates.
Oh, a pulmonary embolism.
The deep venous thrombosis.
Oh goodness, yeah.
So that's the thing. And when this friend told me, and I said, hey, but do you know that that was preventable? That shouldn't have happened. How? Moving your dad. But why didn't they tell me? Why didn't they tell me? I would have moved my dad's legs and all day if it was necessary to save his life.
It's so fascinating to me because, that information is, we know that, but we don't embed that knowledge even, into the systems. It goes back to what you said earlier. These are systems issues. We can fix this issue if we think of it through the lens of a systems level. But also, when we do, as you tell the stories so that people are more alert and more keen to ask those important questions. Diane, thank you so much for taking the time to speak. And I learned so much from you tonight. Every time I see you, I feel like we're kind of passing by each other, or we're doing an interview or something very, that's got a short timeline on it. So I'm looking forward to maybe asking you again if I have a few more questions that are in the back of my mind, but I'd like to ask those another time if you'd be willing.
Oh, always, dear Vonda, thank you so much. I admire all what you're doing, all this zigzag for patient safety that you are doing.
Thank you.
It's admirable, all your restless work for patient safety. Congratulations, and thank you so much. Thank you so much for this opportunity to be speaking with you.
Thank you, Diane. And I know we'll be unified this week on Thursday for World Patient Safety Day when the Unite for Safe Care campaign is officially its first year launch. And I'm hopeful that we'll just build upon it over the next year and do even more next year. Have a lovely evening. Thank you. And we'll be back in touch soon. And thank you for watching and listening to Diane today. I know if you have questions, you can always email me, and I'll be sure to put a couple of links for you to check out in the section below. Take good care.